have Francis here today to remind me to record. Okay, so we are recording this class. So if there's if there's something that you miss, you could just check it out on YouTube. I'm going to put it up on YouTube. It's going to be under my name, Barbara Bro, as you see on the screen there on YouTube. And I also have many other classes that that we've had. We've been having this class on Saturdays since back in the summertime. We were doing this class. So anyway, so without anything further, we'll go ahead and get started. So the topic of my class is, of course, natural solutions. So what we want to kind of talk about is just ways that we might be able to target our health and maybe health issues, keeping ourselves healthy, trying other ways to maybe take care of different issues. I was really hoping that that Chanel was going to be here today because I was going to talk a little bit about sickle cell. She was interested in that. So if Sharon, if maybe you want to send Chanel a text real quick and just let her know that that we are going to be talking about sickle cell, maybe she can join us. And because I don't know if I actually sent her an invite for today's class. So Sharon, if you could go ahead and do that. But anyway, we're going to talk about just several issues and several different oils. We just want some solutions, right? And we want it to be done in a more natural way. Oftentimes we are very dependent upon pharmaceuticals. We're very dependent upon doctors. But one of the things that I have found is that I can actually take my health in my own hands, right? I don't have to give over the authority of my health to somebody else. In other words, and I'm not saying anything about doctors because they definitely have their place and they definitely have their time. But one of the things that I found is that there were times where I actually went to the doctor and I had already diagnosed myself, just doing maybe a little bit of research, and the doctor did not even think about that. And it wasn't until I spoke up and started advocating for my own self that the doctors were able to actually help me better. Now, does that mean that doctors are useless? Absolutely not. But what I'm saying is that we need to also be in that discussion. In other words, I'm not just giving up my authority all over to the doctor and whatever medication he wants me to take or whatever procedure he wants me to have, right? Because there could be a lot of times in a lot of cases where you become just very, very indebted to the system. And so you're on this medication and that medication and then this medication to counteract the side effects from that medication. And it's a downward spiral. And so my idea is that essential oils very much so can be a natural solution for a healthy life, okay? There are going to be the times where we must see doctors. There are going to be times where we must take prescription and pharmaceutical medications. But what we want to do is we want to lessen that amount. Okay, so let's just talk just a little bit about essential oils. Okay, so essential oils are found in the plant, in the stem, in the bark, in the fruit, in the root, right? They're found in leaves. They're found in all of these places in nature, what God has created for a very good reason. Plants use them. We're going to talk about that in a few minutes. Plants need and use the essential oils for their own good. But one of the things that we're going to find is that our structure and our anatomy, and even a lot of the physiology behind the anatomy, is very similar to that of a plant. Okay, so we talked a lot about this last week, about how that essential oils have the ability to pass right through the cell membrane. So those of you who were on the class last week, the topic was if your cells could speak. And we talked a lot about the cell membrane because that's really a very, very important thing. It makes no sense to go ahead and to take something or to introduce something into your body that cannot work and act at a cellular level, right? That's the problem with antibiotics, okay? They cannot work at those cellular levels, which is the reason that you don't, your doctor does not prescribe, or usually does not prescribe, or should not prescribe antibiotics if you have a viral infection, right? Because where is a virus? A virus invades and inhabits the cell. That's where it does all its dirty work. Antibiotics cannot penetrate the cell, okay? Because the cells have a lot of, they have what I like to call them, they're like toll booths, okay? You can enter, but you cannot, right? Essential oils don't even have, they bypass those toll booths. They literally diffuse right through the cell membrane. So that's key to understanding how essential oils do their work, okay? So they are very natural. The beautiful part about them is that they're very aromatic. So they're very pleasant, right? They're beautiful to smell. They're beautiful to put on your skin. They actually make you feel good from the minute that you come into contact with it, right? So they are extracted and they're distilled from plants for the health benefits that they can provide from us. Now, each essential oil, I should say, contains hundreds of different compounds in them. Okay, so they're very versatile, right? One essential oil can actually work on several different health issues, right? So very, very important to understand, right? So each essential oil, you buy one and it actually benefits you in many ways, many different ways, okay? Essential oils work with the body to address issues at the root cause, just like I was talking about, at the cellular level. Very, very important. If you didn't hear the class last week, If Our Cells Could Speak, look on YouTube, it's up there, take a peek at it. I know I enjoyed putting it together. It is very sciencey, but you know, I mean, to me, all of these essential oils, they are chemical compounds, right? We live in a chemical world and it's all about chemical reactions, right? So it's very, very important that we kind of, you know, maybe have some basic understanding of some of the science behind essential oils. Now, essential oils literally are pennies per dose, okay? Now, when you compare that to pharmaceuticals that I know I've seen the cost of them. I mean, they can be very expensive, right? And essential oils, at any given time, a dose of essential oil for whatever issue you might need it for is from 1 to 3 drops. Any more than that, and you're pretty much just wasting the oil, okay? So you need only a few drops to do a lot of good things in the body, okay? And I wanted to include this, and this is just kind of like for the wow factor. When you think 1 drop of peppermint is equal to 28 cups of peppermint tea. That's big. I mean, that's really, really significant. Okay. So, you know, just to kind of give a little bit of, you know, of just an idea of what it is that we're talking about, right? Now, with essential oils, one of the things that I want everybody to understand is that not all essential oils are created equal. All right. Now, I'll give you a for instance. If you go to Walmart, and I can only say that because this is what I did. You go to Walmart and you pick up a bottle of, let's just say, wild orange essential oil, right? You turn it around and it is going to say on the back, it's going to say for aromatic use only, not for internal use, okay? It might say topical, but it would never say internal. It will always say not for internal use. Now, think about that. You have an orange and you can't eat an orange. Because that's in essence what you're saying. I have a bottle of wild orange essential oil that says it's 100% natural, right? And then it says you can't consume it, you can't take it internally, but yet you can take an orange and you can eat the orange, right? I mean, last I heard, oranges were edible, right? So why do they say not for internal use? The reason is found right here on this screen, is because of the synthetics that's actually found inside of that essential oil. They're not food grade, they're not therapeutic grade, and they are certainly not certified pure therapeutic grade. Now, you pick up a bottle of essential oil that doTERRA makes, wild orange, and you look at the back, it encourages you to take it internally. Why? Because doTERRA's essential oils are CPTG grade. They are the highest grade essential oil that you can find. They are certified pure therapeutic grade. In other words, they take it one step above organic. So they are organic, they are pure, they are therapeutic, they are food grade, but they are certified. They do extra testing with the essential oils that you're not going to find anywhere else. Okay, so that's why I would say doTERRA, if you want to take these oils, especially if you want to take them internally, which by the way, and I was sharing this with my son the other day, is that what's the difference between inhaling an essential oil, because it's literally going into your bloodstream. If anybody understands anything about the respiratory process and the diffusion of the oxygen in the alveoli into the bloodstream, you understand that what you inhale is actually going into your body. It is actually going into your bloodstream. That's why they talk about smoke and pollution and things like that, how that it creates cancers and things inside of our body. Why? Because that pollution is actually going into your body the same way that the essential oils that you diffuse are also going into your body. So I just wanted to put that out there just so that we all understand that not all the essential oils are created equal. So now wanted to talk just a little bit about the molecules when you think about these big numbers, right? So when you think about one single drop of grapefruit oil, and if all the molecules inside of that single drop of grapefruit oil were shared evenly among all the cells in your body, each individual cell would receive 6.1 million molecules. That is really big. Okay, and we're going to talk a little bit about that here in just a minute. That is really big, 6.1 million molecules. Now, we're going to talk about how quickly these essential oils literally become a part of every single cell in your body. Okay, now, how do they work, or how fast do they work? 22 seconds, the molecules reach your brain. Now, one thing to understand also that I'm not going to talk about today that I do like to talk about is what's called the blood-brain barrier. We have a barrier in our brain that does not just allow anything up there, right? Indiscriminately, right? It's very selective at what gets up there, thankfully so, right? But within 22 seconds, the molecules reach the brain. Essential oils go where nothing else can go. They can cross the blood-brain barrier. That's pretty significant, okay? That's why essential oils, and smells in particular, have a sedative effect, have a relaxing effect. They can actually deal with a lot of neurological issues, such as Alzheimer's, Parkinson's, depression, ADHD, autism. Essential oils can actually help in those conditions, okay? We can talk about some of those things at another time. I didn't incorporate that information in this particular slideshow or in this particular PowerPoint, but anyway, so within 2 minutes, the essential oils are going to be found in your bloodstream. And within 20 minutes, they will have affected every single cell in your body. Okay, so I don't know about you, but I mean, to me, that is so interesting. It is just so interesting to think that these essential oils are just that fast, right? That they can do these things that we're talking about, that they can act that fast, right? Has a lot to do, with metabolism as well. And we're not going to talk about metabolism in this particular class. But so why do I always talk about essential oils? Why do I use essential oils? Why am I trying to get other people to use essential oils? Well, I very much believe that essential oils are literally God's gift to us because they benefit us in ways that nothing else can. Now, plant chlorophyll, it's almost identical to our own red blood cells. Okay, so with that being said, our bodies readily accept the essential oils, metabolize the essential oils, and then eliminate whatever is not needed of those essential oils, right? Very, very important to understand about receptor sites. Receptor sites are a huge issue for any kind of a neurological issue. And essential oils contain those compounds to actually clean those receptor sites. It's kind of like, take like, you know, I know we're a bunch of women, but just think about, you know, the car batteries, right? And I like to watch men working on the, you know, on the engine. And, you know, one thing that I see that they do is that they clean off those battery terminals, right? And they're doing that for a reason, right? So that the proper connection can happen. Right, so there's enough of a connection, so the voltage is high enough to what the battery needs, right? So think of those receptors as that. Okay, they can get corroded and corrupt after some time. Okay, free radical damage, toxins, heavy metals, all of those things, right? So essential oils have the ability to clean our body of these different foreign and bad things, right? Corrosive things, right? So they're very highly effective in doing that. They're also highly effective against pathogens, right? Unlike antibiotics, because their application does not result in resistant strains of bacteria. Now, we've all heard of MRSA, right? It's a resistant strain of bacteria, right? And so, you know, somebody who has MRSA, you put them on, you know, just a normal antibiotic, like, you know, maybe like amoxicillin, you know, very low, mild type, you know, and it does nothing because that antibiotic is so, it's, you know, the bacteria is now like, yeah, we've seen that thing before, you know, that's no threat, right? Because the bacteria now is stronger. And so essential oils, our body doesn't go into those resistant type stages like it happens with antibiotics. Okay, so it's just very, very important to just kind of understand just a little bit of the background as to why essential oils are just so effective, right? So this is really, really big. And I talk a lot about the oxygen when I'm talking about anybody who has any kind of brain trauma. Okay, now what is brain trauma? Brain trauma is not just like if you get into an accident and you get a blow to your head, although that is brain trauma. Brain trauma is also if you've ever suffered a stroke. Okay, that's a brain trauma. What do we need for brain trauma in order to help ourselves to recover from that brain trauma? Okay, whether it is a blunt force injury or it is a stroke. Okay, what do we need to recover from brain trauma? Well, we need oxygen. Okay, and if you have no idea where to apply the oils in order to deliver those life-giving benefits and the oxygen, the increase of oxygen, get it on the insides of the arms. Why? Because you have got so many arteries that are running directly to the heart. That's why a lot of times if you're having a heart procedure, oftentimes they're going to go through your radial artery, or they're going to go through your basilic artery. They're going to go through these different arteries because it's direct. It is a direct pathway to the heart, right? That they're also going to go through, you know, like if you have a central line or, you know, something, they can also do it that way too, or they're going to go through your femoral, right? So there's all of these ways, but one of the things to understand is that essential oils literally deliver oxygen to our cells. It's really, really interesting, and I'm not going to go into all the sciencey kind of stuff, but I do have this, I'm trying to think of what the class might be. It's probably about, I'd say at least 4 months ago that I gave a class, and I talked all about, it might be the class that's called the King of the Oils, because I talk a lot about frankincense whenever I talk about delivering oxygen and any type of a head trauma, a brain injury, those types of things. Frankincense is very, very effective. Matter of fact, they're doing a lot of studies in a lot of the hospitals with using frankincense in some of the different studies that they've got going on. Now, all right, so I know there's a lot going on this slide, but I just wanted to talk a little bit about how that you can use oils to restore. So in other words, to fix problems, to prepare. So that's like, you know, what I look at is that you're preparing maybe, you know, for older age. You know, we know that things are going to happen in older age, but let's just prepare our bodies. How do you do that? One, you know, losing as much weight as you can. I'm not talking about anorexic type thing. I'm just talking about losing that weight. I mean, we all have the, you know, just have this, it's something that just happens to us as we get older is, you know, you pick up a pound here, you pick up a pound there, unless of course you're like Steve Burke, right? And you never seem to gain weight anywhere, right? He's probably as skinny today as he was back in, you know, back in the 70s or whatever. But anyway, point being though, these are things that we can do to prepare for old age and then prevent. How do we prevent diseases? How do we prevent issues, health problems? How do we prevent that? Okay, a lot of that is going to come through our diet. A lot of that is going to come also, I look at is having the right outlook on life, right? And that's one thing that, you know, that we're taught, you know, through scripture is, you know, to think on these things, right? The things that we think about, it helps us to have a good outlook, and literally it can lower our blood pressure, right? Because one thing that we find is a lot of times people with blood pressure are high blood pressure, I should say, are people that allow the stress they literally own that stress, right? And they take it into their bodies. People who have GI issues, whether it's ulcers, different stomach and digestive issues, a lot of times that's because of stress, okay? So that's one way of preventing issues. But then look at these essential oils and look at what they can do for you. Take a snapshot of this slide if you would like. Look at this, serenity for anxiety and stress, just like what we were talking about, right? Breathe for breathing and sinus. It's also good for people who snore, people who have sleep apnea, right? On Guard for immunity. It boosts that immunity. You can gargle with a drop of On Guard in a little bit of warm water after you've come in for, maybe you were at the store or whatever, you come in and you gargle with it. And what it does is it will kill the viruses that are found in the nasopharynx area, which is actually where the viruses set up shop before they actually go in, you know, to the rest of, you know, your respiratory system and do their dirty work. So, you know, just, you know, these are just some ways that we can actually, you know, just prevent things from happening, right? The deep blue. I absolutely love that deep blue. You know, maybe you have you know, an issue with your back, something, whatever. You get some deep blue on there just a couple times, and all you need is like maybe the size of a dime, size of a nickel, and you just rub it on there, and oh my goodness. You want to talk about a comparison between BioFreeze and deep blue? I had broken my shoulder. This was a couple of years ago. I actually broke the humeral head of my shoulder. I was feeding a dog, and I was in a hurry, as I always am. I just stay in a hurry. And I bent down to either pick up the water dish or put the water dish back. And I just went sailing, and I landed right on my shoulder, and I heard a big crack. And I was all by myself. I had to drive myself to the hospital. This arm was literally limp. And, you know, I'm trying to, you know, do the stick shift and everything, get myself to the hospital. And so I took myself to the hospital. Sure enough, it was broken. But it was broken in a really bad place. It was broken where the rotator cuff actually goes over and inserts itself. It attaches right onto the humeral head. So the doctor told me I actually had two injuries. One was that I broke the bone, but the place where I broke it was a very, very, you know, it was a risky place, because if I were to have been using that or trying to, the of those muscles literally could have broken the bone right completely off. And then of course I would have needed surgery. Thankfully I did not, but I say all of that to say, when I was going through physical therapy, they had these BioFreeze samples at the front desk. And, of course, being, who I am, I'm going to go and do the comparison because I already had Deep Blue at home. So I took the BioFreeze samples and I tried the BioFreeze and okay. And then I tried the Deep Blue and I was like, oh my goodness, there is no comparison between the two of these, right? So if you do not have Deep Blue in your house, and if you have aches and pains, muscle issues or whatever, please let me know and I will send you some samples of Deep Blue and you will agree with what I just said to you. There is no comparison to how powerful and how well Deep Blue works, okay? Any kind of pain, muscle pain, joint pain, bone pain, just give it a try, okay? If you look at the ingredients in Deep Blue, it's astounding what's in there. But anyway, enough to be said about Deep Blue. Then of course we've got the digestive issues, right? And most everybody I know has some type of a digestive issue. A lot of it is going to be found because of the foods that we eat, right? One of the things that I found is when I cleaned up my eating, I didn't have the digestive issues. When I eat something bad, I can usually tell that it's bad because of how I feel, right? Whether it's bloating, gas, pain, otherwise, right? Digest Zen is an oil that is one of the most, what do you call? It's extremely popular. That's the word I guess that I'm looking for. It's very popular. A lot of people use it, and those that use it absolutely love it. You can literally take that bottle of Digest Zen, drop 3 drops onto the palm of your hand, rub it on wherever on your abdomen that it's hurting, the gas or the bloating, whatever, and within seconds you have relief. If you have GERD, if you have Crohn's, if you have diverticulitis, if you have inflammatory bowel disease, IBS, whatever it might be, try that Digest Zen because I think you'll really like it. All right, let's go ahead and advance this. All right, I've been talking about this every single Saturday, and I don't want to stop. And the reason that I don't want to stop is because of the season that we're getting ready to go into. Now, I know people that deal with seasonal issues, allergies, and things. I'm not one of them. I've never had allergies, but I know a lot of people who do. And I know that it's almost debilitating sometimes. I actually know somebody that literally didn't even want to go outside during a certain period of time of the year. And I mean, my heart definitely goes out, to people who, who have to deal with that type of thing. But this is a product that it has lemon, lavender, and peppermint. It's called Tri-Ease. And this product is so helpful for folks who have seasonal allergies. I would definitely like to encourage folks, if you do have allergies and you are looking for a natural solution to try to take care of that, order this product now. The reason that I'm saying this now is because next month and into March, you might have some problems with this product being available, okay? Because at certain times of the year, certain products, they sell out really fast. And this product is getting ready to go through that particular stage of being sold out. So if you do have seasonal allergies, go ahead and get yourself some Tri-Ease and just hang on to it. I would say about 2 weeks, 3 weeks before the allergy season actually starts, start taking these pills. Okay, it's a soft gel and it literally has lemon, lavender, and peppermint oil in it. It's as simple as that, right? It's a little soft gel. It's like a veggie cap. But I will say that you're going to like it. So, All right, On Guard. I wanted to put this up here because, you know, I use all of this, right? I use every single product here and absolutely love it. And that little On Guard up at the top right is actually a sanitizing mist. I actually keep that in my Bible bag. And, you know, after I'm done greeting all my, you know, greeting everybody, I take that On Guard, get it on my hand before I touch anything else. But anyway, it is very important to, you know, to talk about, you know, viruses and bacteria. And this product line is very, very effective at doing just that. All right, now I'm going to kind of go into some meatier stuff. I want to talk a little bit about some different issues, some different health complaints, high blood pressure. High blood pressure is so prevalent. It's almost like every other person that you talk to has or has had high blood pressure, otherwise known as hypertension. There are natural ways that we can target and take care of our blood pressure issues. Okay, we don't have to resign ourselves to I'm always going to be taking high blood pressure medication, because one of the things that I find is that you take a pill for this, then you have to take another pill to counteract the effects of that pill, and then it's just a never-ending cycle, right? These are 4 oils that can target high blood pressure, but these are not the only ones. There are many oils. Matter of fact, there's an oil that actually, it will raise blood pressure, it needs to be raised, and will lower it if it needs to be lowered. So what I mean by that, get this itch on my nose, I don't know where I'm getting it from. But anyway, maybe it's because I was talking about allergies or something. But anyway, I thought it was unbelievable to hear that there is actually, it's almost as though these oils can balance our blood levels and blood pressures. And because you know what blood pressure is, it's literally, it is the smooth muscle that lines our arteries. That's all that blood pressure is, whether it's dilating or it's constricting, right? One way or the other. And a lot of that has to do with our kidneys, by the way. So if you have kidney issues, you're very likely to also have blood pressure issues. But anyway, I know I go off in these tangents where I start talking about some type of a biology or anatomy or something. And anyway, okay, I want to talk about 3 fur oils, okay? Siberian fir, Douglas fir, and white fir. 3 unbelievably, wonderfully smelling oils, and 3 unbelievably, is that a word? Unbelievably essential oils. Look at what these things do, okay? So here is Siberian fir, okay? So it helps to balance the emotion, soothe anxious feelings. It promotes, it says after strenuous activity, it provides comfort. That comfort would be to our muscles, to our joints. And it's very, very relaxing. And look at this. Very, very good for any kind of a skin irritation. So it's not only good for our insides, but it's also good for the outside of the skin, as well as it's good for our mental. Okay, so here we've got an oil that smells absolutely wonderful. Okay, it is good for so many different things. Okay, so here, good for our muscles, good for our respiratory health. Very, very good to relax if you're exhausted. And I know that there's a lot of times for myself that, you know, I don't know. I think I exhaust myself sometimes because my brain moves way faster than my body ever can. And that could be kind of exhausting all in itself. Anyway, it's very, very good for blood flow. Okay. Cypress is also very good for blood flow. Zena could actually say a thing or two on that. Here's Douglas fir. Okay. Now Douglas fir, you can only buy it in these smaller bottles. Okay. These 5 ml bottles, as opposed to the Siberian fir. This is a 15 ml bottle. This is a smaller one. Very, very good for respiratory, purifies the skin. Now that's pretty interesting. and it promotes a positive mood and sense of focus. In other words, it's very, very good to diffuse, very good to breathe in and just relax, maybe at the end of the day. Doesn't have to be at the end of the day though. I'm actually diffusing, it's called Northern Escape. So those of you who live up north, Northern Escape. And what's in this is black spruce, Siberian fir, as we were just talking about, balsam, which is a Canadian balsam, lavandin, cedarwood, cypress, hinoki, frankincense, kanaga, and nuka. Oh, I'm sorry, and also clove. This has got so many cool oils, and I've got it diffusing right here behind me. That's why I wanted to bring it to show you guys. It's a 15 ml bottle. So this thing, I don't even know how long I've had it, but it's literally, I don't know if you guys can see it. It's like just barely, you know, and I use it a lot because I love the fir oils. That's the reason why I actually wanted to include them, because I was like, what's an oil that I would like to learn more about? And these were one of the first. Arbor Vitae was the top, but these were next. We'll talk about Arbor Vitae here in just a minute. All right, so combine Douglas fir with wild orange, lemon, or bergamot in a diffuser to freshen the air, uplift the mood, promote a sense of focus. So here's another for easy breathing. You put it in eucalyptus. What you can do is you can actually drop a couple drops in the palm of your hand, maybe one or two drops of eucalyptus, rub your hands together, cup your hands over your nose, and just keep breathing to clear your airways. And boy, I tell you, it gets into your brain like that. Try it. Just one thing, be very, very careful. Don't get the oils in your eyes. So when you're doing this, keep your hands away from your eyes. All right. You can also use this Douglas fir with wintergreen for a massage, if you are so inclined. I wanted to include this for those of you who are like me and absolutely love diffuser blends. I am always on the hunt for new diffuser blends. I just love diffuser blends. So anyway, if you want to take a snapshot of this, Picnic in the Mountains, I was actually going to do that one. And then I said, oh, let me try this Northern Escape instead. So all of the woods, under the stars, freshly frosted forest, take a hike, sweet forest breeze, the great outdoors, and windless forest. And the last of the three firs is the white fir. Okay, so again, this is a larger bottle, 15 ml, and it's only from the needle part of this tree. Very good again for any kind of a muscle. So one thing to note, that all three of those fir oils are very, very good for massaging, for muscles, for joints. And then also all three of these oils are very, very good to diffuse. They are good to de-stress. They're very good to just relax the mind. Okay. And another thing I wanted to also make sure that you guys take note of is that all three of these oils can be taken internally. Okay. So that's something to remember, because not all oils are for internal use. Okay. Now, this particular oil that I have on my desk here, the Northern Escape, this one is not for internal use. Okay. Now, I know we talked about it just a few minutes ago about, you know, taking the oils internally, but just remember that not every essential oil should be taken internally. Okay. Obviously, like we were talking about wild orange, I mean, that's a no-brainer, right? Of course that should be taken internally, but not every oil should be taken internally. We're going to talk about Arbor Vitae in a few minutes. Arbor Vitae is one of those, but all of these fir oils can be and should be taken internally. So just an interesting thing to take note of. Okay, so here is some more information on white fir and what it's beneficial for. Once again, arthritic pain. You've got arthritis, get a little bit of fractionated coconut oil, a couple drops of white fir, rub it into your joints, get it in there, that rubbing, the fractionated coconut oil is very, very good because it actually helps with the absorption, right? So, and if you want any more information on that, we can talk about it later. But look at this. It's good for colds and flu, good for congestion, disinfectant, good for blood support, muscle pain, joint pain, infections, and it's saying much more. Wow. That's, I mean, as far as I'm concerned, that's pretty unbelievable. Okay. So again, I just wanted to throw this up here once again, just as one more, little, just because I love the slides. Okay. This is what I was going to diffuse this morning, the picnic in the mountains. And I chose the Northern Escape instead, but white fir, balance, eucalyptus, and Douglas fir. Just the thought of it is just beautiful. Anybody, who loves, the outdoors and the mountains, and I love that smell. But anyway, all right, here we go. I wanted to talk a little bit about sickle cell anemia. And the reason that I did is because Chanel had actually asked about it last week. And so I wanted to just make sure that I include some information. So what I generally do is when somebody has a question on something and I don't right away know, I need to kind of do a little bit of research. And I might know a little bit, but I don't know enough to really speak on it. So what I wanted to do is I wanted to give some decent information. And so this is what I came up with, Chanel. And if anybody else knows anybody that has sickle cell, get them onto the YouTube. This video will be up within the next couple hours and they could go ahead and take a look at it from there. But here we go. We just want to talk just a little bit about sickle cell. So first of all, we kind of want to understand what it is, right? And we understand that the disease, sickle cell, is actually characterized by the sickle-shaped red blood cell, right? Red blood cells are supposed to be, they're kind of like shaped like a plate, they're kind of indented in the middle and they kind of, and the whole purpose of, well, not the whole purpose of, one of the purposes of the red blood cell is to deliver oxygen, right? Very important to deliver oxygen all around our body, right? Well, now sickle cell, as it's characterized by that, abnormally shaped, it goes into like that shape of a sickle or a crescent. And it makes it difficult for them to travel through the blood vessels, okay? So, okay, a lot of this stuff I already actually said. Okay, so what that means is that it makes the blood cells, the red blood cells, very fragile. They can break, they can become lodged, and they could create blood clots and not get that blood flow into the places where you want that blood flow to go, right? Which is all around your body, right? Very, very important. Now, not every red blood cell will be sickle shaped, but the more the disease progresses over time, the higher the number of cells that's going to be deformed, all right? Now, sickle cell anemia will cause red blood cells to die in about 10 to 20 days, as opposed to about 120 days. So normally our red blood cells, and we understand, or if you don't understand, that bone marrow creates, blood on a regular basis. Our red blood cells eventually die and they get replaced in a normal, healthy body, okay? If you are somebody that suffers with sickle cell, oftentimes you need blood transfusions because your red blood cells are dying faster than you can create more, right? So the causes of that is that these people, the ones with sickle cell, they usually go into anemias, which is a lack of oxygen, right? There's different kinds of anemias, but this is sickle cell anemia. And it causes a lot of real devastating effects on the body. And if you know anybody that's ever had this, you definitely understand. I had somebody very close to me that suffered with this, and I mean, it was terrible just to watch her go through, you know, the pain and the suffering and the hospital visits. And it was just like, I mean, she was literally a slave to this disease, and it was terrible to watch. But here are some of the symptoms. Now, of course, we know that just because you have one of these symptoms does not necessarily mean you have sickle cell, but having enough of these, you know, might mean that, you know, you do want to go ahead and, you know, go to the doctor and, you know, get it checked out, right? So if a sickle cell crisis or emergency occurs, patients usually need to stay in the hospital, like I was telling you about, you know, the friend of mine. And the most obvious symptom will be pain. So what that means is that 1 minute she was absolutely fine. And then the next minute she was doubled over in pain, right? Just terrible. She eventually needed to be on oxygen all the time, right? Blood transfusions all the time. And then, of course, a whole course of pharmaceutical type treatments, right? Whether it's hydroxyurea, whether it's, you know, hey, you need a bone marrow transplant, which that doesn't work for everybody, or gene therapy. There's all of these ways that, you know, that doctors, you know, are coming up to try to combat this disease, because it's a debilitating disease. And like I say, it's just very sad to, you know, see anybody go through it. But there are some natural treatments that you can use as well to maybe complement maybe what you're hearing from the doctors as well, and talk to your doctors about some of these things. You know, ask them what they think, right? A lot of doctors are you know, they're very, you know, sympathetic, and, you know, they listen to, you know, some alternate, you know, forms of medicine. And I actually like doctors who do that. You know, that it's not just all about, you know, hey, you got to take this prescription, or hey, you got to, you know, do all of this. There are other things, there's other ways that, you know, that we can combat this disease. So of course, making sure our diet, making sure we're getting enough water, exposure to sunlight is so important. And just having, you know, having some exercise is also very good. So I know this slide, I put it together and I was like, okay, how can I, you know, what I wanted to do is I didn't want all the attention to be on all the writing. I wanted the, you know, the healthy foods to come through, which I think that they are, but I wanted to pull out some very key things. So I enlarged the text and highlighted them. So here are some ways that you can combat, and these are things that empowers you, right? Make sure you get enough calories, okay? Very important, okay, for sickle cell patient. Now, people that are totally, you know, we wanna reduce our calorie intake. If you have sickle cell, it is very easy for you to go into you're malnourished. Very easy for that to happen. So you got to make sure you get enough calories, making sure that those calories are quality calories, right? Plenty of fresh produce, plenty of protein and healthy fats, foods that are high in folate, okay? Look that up. I've got some of them that are listed here that you probably can't really see: avocado, beans, chickpeas, right? There's a lot of foods that you can find that are high in folate. B vitamins, very important. B vitamins, okay? You're going to get a lot of that in the protein-rich foods. Drinking enough water, so important. And then avoiding, you know, processed packaged foods, you know, because most of them are usually very bad. Now, very important to get vitamin supplementation. Okay? If you have sickle cell, or if you don't have sickle cell, this is very important. I take these 3 nutrients on a regular basis, right? Because I'm in that prevention. I don't want to, you know, I don't want to get anything, right? I shouldn't have to get anything, right? Now, I'm not saying, I mean, some people, they've got, you know, hereditary, you know, factors, you know, genetic, you know, makeup that actually are going to, but we're also trying to prevent anything from happening, right? So vitamin D, very important if you have sickle cell. Calcium, here we're talking about the folate again. Omega-3 fatty acids. This includes your EPA and your DHA. Very important, okay? That XE omega has both of those in there. Very, very important for any kind of neurological function. And then here we go with the vitamin B, you know, all of your B vitamins, very, very important. All right. And then, of course, the multivitamins that include copper, zinc, magnesium. They have been found to be very beneficial for anybody who suffers with sickle cell. I wanted to just share a couple of these slides just to show each one of these supplements kind of up close. So this one right here is the XE omega, and it is a wonderful, wonderful product. Okay, we can talk more about these in depth, but these are some things that you can take a snapshot and kind of read up a little bit more with this. But this is what I'm talking about. Delivers 900 milligrams of pure concentrated molecularly filtered fish oil with 300 milligrams of EPA and 300 milligrams of DHA. Now, just look those things up. Okay, and then again, this gives you your omega-3, your omega-6, your omega-9s. Very, very important. But on top of it all, okay, I call the little cherry on top, right? This is giving you clove, which if anybody has any idea what clove, it has the highest antioxidant level of any substance on this planet. Clove bud in particular, from Madagascar. It's a beautiful, beautiful product. So I get that on my body every day, and I'm gonna keep on doing that, because if you don't know anything about antioxidants, I have a whole class that we talked about antioxidants. Antioxidants are your friend, right? That's why we eat all the berries, right? Berries are very, very high in antioxidants. Well, guess what? Berries are nowhere near as high in antioxidants as clove is. Okay, now that's just one of the oils that's included in this. You're also getting frankincense, thyme, cumin, wild orange, peppermint, ginger, caraway, German chamomile. Okay, so these are some very, very excellent products. Here's the Microplex VMZ. Again, fighting that free radicals. They're very high in antioxidants again. These products are very, very good. Okay, these are whole food nutrient complex. The Microplex VMZ and the Alpha CRX, which we're going to talk about next. But look at what's in this. A whole food blend of kale, dandelion, parsley, kelp, broccoli, Brussels sprouts, cabbage, spinach. Look at, I mean, what's in this is just unbelievable. Plus it has the tummy tamer, peppermint, ginger, caraway, so that it doesn't bother your stomach. Now here's the Alpha CRX. Now this is a cellular vitality complex, okay? This is an absolutely amazing product. Look at what's in this, okay? Polyphenols, resveratrol, ellagic acid. Let's just keep on going down. Ginkgo biloba, boswellic, which boswellic is frankincense, coenzyme Q10, how do you say that? Quercetin, alpha lipoic acid. The things that are in these products are things that are just, they have been researched and just shown to be so beneficial to our aging bodies, right? And especially if you've got a disease going on, such as sickle cell anemia. Now, I want to end talking about sickle cell with these last few products, okay? Essential oils are a great way to target the pain, because a lot of times what happens is you're put on very high dose pain medications. People become addicted to them, and they do a lot of bad things to our body. I'm not saying that they don't help and that they don't work, and sometimes they are needful. But there's a lot of people that literally get addicted to these pain medications, right? So there are essential oils that actually can help to treat pain, okay? Peppermint is one of those. Frankincense is another, okay? The reason that frankincense is very good for treating pain is because it helps to reduce inflammation. Whenever you hear that word inflammation, you could just liken it to the same word pain. because inflammation, it's part of it's a process that our body actually goes through. It's like a cascade of events when you're actually looking at it, you know, in a scientific way. One event promotes another event, which promotes another. And oftentimes what happens is that cycle of inflammation never ends. We're always in some cycle somewhere, and we always have pain, right? So that's where inflammation could be, you know, damaging and harmful to us, right? So inflammation is good. It's got its place, but we don't want it to be happening all of the time. So frankincense is very good to kind of reduce some of that inflammation. Now we also have lavender. Lavender is very good for any kind of stress. What it does is it calms down the mind. It calms down the body. That's why it's often called the all things calming oil, right? Lavender. It's a beautiful oil. And then the uplifting oils, such as grapefruit, such as lemon, such as orange. What they do is they uplift, they stimulate, they energize, right? This is the type of oil that you would want to do your spring cleaning with, right? I actually do. I just, you know, put a couple drops of lemon or On Guard or wild orange, you know, on my counter, and I just wipe it down, and you're smelling this beautiful smell while you're cleaning, and it just makes you want to clean even more. So, hey, if you have a kid that doesn't want to clean, maybe just put a little bit of wild orange on the washcloth or whatever they're using to clean. Maybe it might help. Who knows? Worth a try. All right. Just really quick, Arbor Vitae, because I told you that I wanted to talk about it, but I don't want to go into it too much because our time is up. But Arbor Vitae is a wonderfully smelling oil. If you have not smelled this oil, you are definitely missing out. Arbor Vitae, literally what they're doing is they're taking the waste product of it's the tree of life, right? It literally is, they just leave it out there. And so we take it and we distill it from that part of the plant and literally make this beautiful essential oil. Very, very good for repelling insects. So if you don't like insects when you're out there hiking, take a little bit of Arbor Vitae. It smells wonderfully as well. But now remember what I was saying about this is an oil that you do not take internally. If you look down at the bottom, I don't know if you can see my mouse right here, you see aromatic, you see topical, and you see neat. Neat just means that you don't have to dilute it before you put it on your skin, but you see nothing there about internal use, okay? That means that this is an oil that you should not, under any circumstances, take internally, all right? Just so you know. Oregano, I thought it was kind of cute when I saw the oil of humility. I don't know where that came from, but I thought it was kind of neat. And I think the reason that they might say is because oregano oftentimes doesn't really get the limelight. You know, it's kind of always more, you know, back in the background. But I'm going to tell you something. This oil is a powerhouse for your immune system. If you want to protect your immune system, you take a couple drops of this, neat, meaning just right from the bottle onto your hands, and you rub it on the bottom of your feet, the sole of your feet at the end of the day. Put on a pair of socks, or if you absolutely don't like socks, don't. I would put a pair of socks on so I don't smell pizza all night long. But this oil is very, very beneficial for your immune system. It is just powerful. And if you just, there's no underestimating of this oil, okay? But it does not get the attention that it deserves, okay? And it's because, you know, it's very powerful in its smell. And, you know, not everybody is attracted to this smell. I, for one, am not. Although I like Italian food. I'm Italian, so of course I like Italian food, but this is so powerful that if you were to put this in your spaghetti, which you can put this in your spaghetti sauce. What you would do is you would take a toothpick, you would just tap the top, there's a little reducer cap, you just tap it in there. So it's not even a drop. We're talking like maybe a fourth of a drop. And you take that toothpick and you just stir it into your spaghetti, a big pot of spaghetti sauce, and just a toothpick tip, you will taste it in the sauce. This oil is so powerful. So anyway, I just wanted to say a few things about it just because it is just an unbelievable oil that does unbelievable things. I mean, it is just anti everything. Antibacterial, antiviral, antifungal. If you got fungus under your toenails or your fingernails, I know people that deal with that, especially as they get older. Oregano is your oil. Use a little bit of carrier oil and oregano. It's antiseptic, it's anti-parasitic. I mean, my goodness, what anti is it not, right? It's just anti everything. I thought that this was so cute when I saw this. This is for all the moms out there, to all the beautiful moms who balance all the many responsibilities, who are the anchor to our families. You are adaptive to every situation. You console, you forgive, you motivate, and cheer us on. You exude peace and hope. Thank you for all you do. We love you. I just thought it was so cute. This is just be your own boss. Anybody who's interested in making a few dollars doing doTERRA, let me know. I will let you know. These are the ways that you can get these oils into your home. This is the cheapest way to get the oils into your home. It contains 10 of the foundation oils plus a diffuser, $160. And you got the top 10 oils: lavender, lemon, peppermint, tea tree, oregano, frankincense, deep blue, breathe, and on guard. This here is another kit. It's 3 times the size of the bottles, but not 3 times the cost. Also another diffuser, which is a bigger diffuser as well. And this gives you 3 oils that one kit that I just showed does not give. This one gives adaptive, copaiba, and balance. And then this is the Healthy Habits Enrollment Kit, an awesome kit. We're missing Terrazyme. I don't know where it went, but we're missing. Here it is again with the Terrazyme. It's $195, but this kit does it. This kit gives you a great start if you want to be healthy, stay healthy, live healthy, have as much energy as you possibly can have. Take a screenshot of this because I'm not going to go into all of these because we already did talk about them. This is a brand new kit. Okay, it's Daily Habits and Nutrition Kit. Brand new kit. The fiber, the greens, and the protein in the back there are wonderful products. Brand new. Okay. And so I wanted to say, just to end with, that our essential oils are totally essential, totally needful, and can do some wonderful things in your life if you just give them a chance. Anyway, I am going to, what did I just do? I usually don't do what I just did, but all right, here we go. Okay, see everybody's faces now. Thank you so much for coming, everybody. We've got a number of people on here, and some people that have not come on in a long time, some people that have never been here. Anyway, this is the time where we got questions, comments, and some free giveaways. I've got this really cool Be Kind keychain, and I've got a doTERRA essential oil keychain that I'm giving away. And for anybody who does not have one of these, I'm giving one of these away as well. This gives all kinds of really cool information about the oils, certain conditions, ways that you can use them. So yes, so anybody who does not have one of these, I just make sure that I find out some way, whether you just let whoever invited you to this class or you send me a text with your address, please. I will send you out those books, and we are going to be doing a giveaway here in just but before we do, are there any questions or any comments? You could just take yourself off of mute. You can raise your hand, or you can just start talking.
Are you still recording?
Thank you, Sharon. I need you to remind me to stop recording. Okay, go ahead with the questions if there are any.
Cynthia's got her hand up.